So I have one thing to do. Sorry, guys. You should know better than that. Well, good morning, Queensland, and it's wonderful to be here from Redcliffe today, and in fact from Woody Point Pharmacy. And our local pharmacists here, Kylie and Steve, are the owners and are one of our many community pharmacies that are vaccinating. But of course, before I talk about them and the great work we're doing on vaccinations, I just want to talk about our numbers today. So the good news is we have 7 new cases in Queensland today, 1 overseas acquired and in hotel quarantine, 6 others that are directly linked to the Indooroopilly cluster, and all of those have had 0 days infected in the community. So thank you once again to all these families who are staying in home quarantine to keep us safe, and also coming out and getting their regular tests so that we know whether anyone in those households or those close contacts are becoming positive. And of course we are still seeing those positive cases turning up late in their 14-day cycle, which reinforces why it's so important that anyone who is ever a close contact and required to go into home quarantine must stay home for their entire period and undertake those tests. So that brings us to 143 in the current cluster linked to Indooroopilly. We have 165 active cases currently, and I thank the 22,774 people who came out and got tests yesterday. And we had 15,158 vaccines. And so we will see those vaccination numbers continue to go up because not only have we got our new mass vaccination centre open this week at the Brisbane Convention and Exhibition Centre, but the great news is, of course, we have our health vaccination centres right across Queensland, and we have our GPs, and now we have our community pharmacies like this one at Woody Point online helping us as well. And they've done almost 300 vaccines here just in a week. So it's wonderful, and I thank Steve and Kylie for their incredible work. We have about 398 community pharmacies now operating in southeast Queensland, and we have over 980 community pharmacies across Queensland now. So if you're wondering where you can get a vaccination, make a booking with your GP, go online, book with your community pharmacy, or some of them will be taking walk-ins as well, or of course register your interest to get vaccinated at one of the Queensland Health vaccination centres, which includes the Brisbane Convention and Exhibition Centre. If we all get vaccinated, we know that this is a really important step for us to be able to open up our economy and stay safe. Again, the message to everybody, please come out and get tested if you have any symptoms whatsoever. Message to everyone, if you're feeling unwell and you know you've got to go get a test, don't pop off to the pharmacy first to get some medicine before you get a test, or on the way home. Please just go straight to getting a test and go home and wait for your results. But I do want to give a shout out to everyone who is helping us, all of our health workers, our pharmacists, our GPs who are helping us with the vaccination rollout. We're so pleased with their support. Now today I've got with me our Deputy Chief Health Officer, Dr Smith, and I'm just going to ask him to say a few words and tell us a bit more about these 6 cases. Thank you, Doctor.
Thank you very much, Minister, and good morning, everyone. So as the Minister mentioned, the case numbers now for the Indooroopilly outbreak is sitting at 143, and we've had 6 new cases related to that outbreak this morning, or at least in the last 24 hours. So they are a 1-year-old sibling of a child who was already in hospital, a case. We've had 5 adults related to both Brisbane Boys Grammar School and Ironside State School. So in addition to that, you'll see 7 new cases in the data, and the 7th case is a 4-year-old child who has come from Cambodia, and that child has been in hotel quarantine. So the numbers are looking very reassuring. It's great to see that all of the 6 cases related to the Ironside cluster were in quarantine at the time and had no days in the community. I think we're now sitting at a little over 8,000 people now in quarantine related to that cluster. It's come down from quite high numbers, almost 19,000 at one point. And we wanted to extend our thanks to all of those families that have really done it pretty tough in quarantine. It's not easy, it is a challenge, and the fact that they have been so good and so compliant about their quarantining has meant that we've been able to get on top of this cluster, and has meant that we're in the encouraging position that we're in now. So we really thank them, and they've essentially done a great job in helping to keep the community safe. There are some families who are still in quarantine and have had cases in their households, and again, we sincerely thank them. It's a tough time. They will be going for longer than the 14 days in many cases, and that is really hard going, but they are doing it to keep the community safe, and I've got no doubt that it's really helped to knock the top off this outbreak. So thank you all very much, and one final thank you just to the contact tracers out there. So there's a network of contact tracers around public health units in Queensland, the Health Contact Centre and the Department of Health. They've all done a great job working together to get on top of this, so we thank them too. Thanks very much.
Thank you, Doctor. And I just want to thank Dr. James Smith for standing in today and allowing our Chief Health Officer, Dr. Jeanette Young, a little bit of a break today. So I will say we've got 8,514 people now in home quarantine. So that means over 7,000 people have been able to come out of home quarantine overnight. I'm sure they're very pleased to finally be out, but that is still 8,500 people who are home quarantining. So we thank them for that. Any questions?
In relation to the 1-year-old, is that one of the youngest cases we've had?
Not one of the young, certainly the youngest in this cluster, but we have had infants before during the pandemic.
Are you concerned that children will be particularly vulnerable? We've seen a lot of kids catch this in this latest outbreak.
I think what this shows us is that we are dealing with a new strain of this virus that's far more contagious than we saw last year, and we do know now with the Delta strain that we see it spreads through children more, and children are being impacted by this virus more than what we were seeing last year. So that means that all of us have a responsibility to keep ourselves safe and to keep others safe by staying home when you're unwell, by going and getting tested if you have any symptoms whatsoever, and of course getting vaccinated, and just those really simple things, wearing your mask, social distancing and good hygiene. And we need to teach our young children, no matter how young they are, as soon as they're capable of washing their own hands, let's make sure that they understand how to wash their hands properly.
In light of so many children getting this new strain, should younger children be getting the vaccine?
Look, I'll get Dr. Smith to address this as well, but there hasn't been any change in advice from ATAGI at this point in time. We do know that 16 plus can get Pfizer and 18 plus can get AstraZeneca, but 12 to 15-year-olds who are vulnerable, who have medical conditions, that they have given advice that those ones should come forward, and we're working with the Children's Hospital to get those young people who are particularly vulnerable because of severe health conditions, making sure they're coming forward and getting vaccinated. But I'll ask Dr. Smith to just comment on any recommendations on what we're seeing around vaccinating children under the age of 12. Doctor.
Thank you. You're right, and there has been a a significant proportion of children in this particular incident, as there has been around the world. We've seen a greater proportion of children with Delta. It'd be wonderful to see children vaccinated, and I hope that'll come soon. But as the Minister said, at the moment we've got our priority groups and we've got the registration in place for those vaccines. So we will look forward to the day when it comes.
With the 1-year-old, I'm assuming that 1-year-old's in hospital. How bad are the symptoms that 1-year-old is experiencing?
I'm advised they're stable.
And how many 12 to 15-year-olds are we expecting to fall under that category here in Queensland in terms of having that medical condition and require vaccination?
Look, I don't have those exact numbers to hand, but we can take that question back to our media team and get a response for you.
Minister, a question for you. Andrew Laming has been, found not wearing his mask. Will he be investigated for that?
Look, I've just heard about this morning. I understand that the compliance unit is looking into the issue. I appreciate that from time to time people will inadvertently forget to put the mask on, but we all have a responsibility. If you are flagrantly going out and not wearing a mask, then there's fines that certainly can be issued to you. The masks are there for a really important reason, and I have to say to all elected members of Parliament, we have a responsibility to lead by example, to make sure we're complying with the rules. And particularly, can I say federal members have just flown back from the ACT, had to leave Parliament early because of the lockdown there. We all know the risks. We know that we've just come out of a lockdown here in Queensland. We have a higher level of restrictions currently, which includes wearing this mask all times other than needing to sit down and eating and drinking, and of course needing to do something like this. But otherwise, if you're out and about in the community, you should have your mask on. That's all there is to it.
In terms of the vaccine, obviously the hub's doubling capacity today. What's bookings looking like and what are wait times like?
So bookings are looking really good, and I know when I had a look at the figures yesterday morning, tomorrow was 98% booked, so I'm sure they'll fill that last 2% before tomorrow. So we're hoping to do around 3,000 today and another 3,000 tomorrow. Because it's a booking system, it means that you don't really wait. It is a really quick line to move through. You get booked in, they send you off to see one of our wonderful health workers to give you your vaccination, and of course, and then you sit and wait and be observed for a brief period of time, 15 minutes or half an hour if you have any particular condition that need to be monitored for more. But the people I've spoken to, they said it's seamless. So big shout out to everyone at the Brisbane Convention Exhibition Centre. All I've heard is positive comments about how quickly people are moving through.
We see some teenagers getting to vaccine bookings because they're listed as dependents with their parents over other adults who work.
Yes, so look, there's a range of reasons. I'm hearing this criticism of teenagers jumping the queue. Can I say that some of these are household members who are prioritised because they may be a household member of someone who works around hotel quarantine. They might be a household member who has someone who works in health or police, paramedics. So we've said we prioritise those households as well now because, of course, if one of those people end up positive and taking it back into the home, we now know with the Delta strain that it is spreading throughout the entire household. We are seeing this year, more than we ever did last year, 100% transmission to every member of the household. We just weren't seeing that last year. So that's why Dr Young has made the decision to allow for the households of priority people to also be vaccinated. Also, when I was at the convention centre the other day, I was talking to some of those young people. They actually work in childcare. They work in before and after school and vacation care. Think back to when your kids were in vacation care or after school care, or they may currently go there. There's a lot of young people, 18, 19-year-olds, who are doing their Certificate 3 in childcare. So please don't be so quick to judge when you see a young person getting vaccinated. They could be one of the people who are looking after your children.
Sorry if you've already mentioned this, it's just really hard to
year.
Sure.
What's compliance been like since the new travel measures were announced?
So compliance numbers are good. Of course, the police want to keep sending the message out that they have ramped up compliance on the borders, and it's really important that anyone who's coming from the ACT, New South Wales, Victoria, understand what the restrictions are. When you are declared a hotspot, you cannot be coming into Queensland by road, you must be coming in by air, and you must have the relevant exemptions or be a Queensland resident. So from 1 o'clock this morning, of course, anyone travelling from the ACT would have to go into hotel quarantine and should only be coming here if they're a Queensland resident or if they have the relevant exemption.
Just on the other children part of infertility cluster, have any of them been suffering severe symptoms at all?
Look, I don't want to talk about individual cases. The important thing is none of them are in ICU. They are in hospital, if any of them. So we do know some of the children are in hospital, not just being cared for at home by health workers, but none of them are in ICU, and I'm really pleased about that. We can get that for you, Jack. Yeah, I do have those figures, so I'm happy to give them to you when I finish about how many are in hospital versus how many are in home. Any other questions?
Border in northern New South Wales. At what point, in terms of numbers, is the figure going to be for us to actually put a hard border back in place for that public?
Look, remembering we do have a hard border already in place, but what we do have is also a border zone, because we know a lot of people work and travel back and forth across that border. Queenslanders working in areas like Tweed Heads and vice versa. We're talking with the New South Wales Government, particularly about that Tweed community, to see if we can ensure that if there has to be further restrictions put in place across that border, that people are able to move across. Especially we've got health workers and emergency workers, police that need to be able to move back and forth quite easily. So we're having conversations with New South Wales currently on that.
The Premier mentioned yesterday she wanted to see New South Wales plan of containment. How soon do you want to see them come to the table with more information around that?
Look, New South Wales stands up every day and reports to the public, just as we do. It's up to New South Wales to report on any changes that they're making to their restrictions or lockdowns. We have to look after Queensland, and that's what the Premier has done every day, taking on board the advice of the Chief Health Officer. All good? Thank you. Now, would anyone like to talk to Steve or Kylie while we're here? Our pharmacists? Yeah?
Yeah.
Steve, you're up.
Hey.
You take the mic there.
Oh, yeah.
Steve and Kylie, what's the uptake been like? Has it surprised you?
It has. It's really surprised us, actually. Like, we have been flat out since we received our vaccines last week on Friday. Received them Thursday afternoon, and by now I think I'm up to 300 vaccines that we've administered in, just every day since then. Didn't open on Sunday, so yeah, we're doing up to 70 vaccines a day. And we've got a wide range of people that are taking up the opportunity. Like, we've got young people that are coming and saying, "This is amazing. I didn't know I could get a vaccine anywhere." And walk-ins, people walking by, going for a walk along the water, and coming in and grabbing their vaccine, and it's been really positive. Hey.
Yeah, they're really taking up the opportunity, particularly as a walk-in service. So they're appreciating the fact, oh look, I've got 10 minutes spare. I'm waiting for a coffee. I might as well go and get vaccinated. So I think that's made a lot of the difference as far as people taking up the jab, is not having to worry about the commitment of an appointment, so to speak, on a certain day and everything like that. But the fact that you come in, get vaccinated. Obviously, appointments help us as far as the streamlining of the process and making sure that the waiting time is minimised. But there still is that convenience of people walking by and all that.
It also streamlines it when there's not all these cameras in the way of our doorway. Yeah. No, but we try to make it take the scariness away from vaccines for people. The hat, the shirts, the badges. We just try to be real, like we're making it real for people. So I think that's a really good thing that community pharmacies can all do. Not just our pharmacy, but all the community pharmacies. Maybe doctors are a little bit more official sometimes, but we still give all the good information. We've got qualified...
That's it, yeah. We go through every aspect of what side effect to expect, whether it's minor. Obviously we go through any of the potential serious side effects as well, such that each individual can have an informed choice. It takes about 15 minutes for the consultation. It's not just a matter of, oh, I jab and see you later. But we cover every aspect, and obviously people walk out with further information that they can take home, not to mention a certificate of vaccination.
You mentioned young people before. Are you seeing a lot of younger people coming to get a vaccine here, considering you can't access them anywhere else?
The age range has been quite even across the board that we've seen. We've had 18-year-olds coming in saying, my mate shared this on Snapchat, I really want to get vaccinated so I can, go back to uni and back to my normal life. We've got, I'm more surprised that we're still seeing 80-year-olds coming in who haven't had a vaccine. I thought that area was more covered than it is, but seems to be a wide range of ages. The 30 to 40s, I think, are the main thing, the main age range we're seeing. But what we're seeing, I think, is that everyone is just really ready. They're ready to get vaccinated.
Yeah. I think the impression that the media has put out, particularly of late, has really changed the perception of the wider population, such that the people do understand the fact that, look, if we all get vaccinated, we can all get back to work, we can all get back to footy, we can all get back to travelling, we can have a tourism industry, and we can really bring Australia back to the way it's meant to be. And so that's something, as a pharmacist, that I'm really keen to actually be a part of, which is why I've been one of the first pharmacies to actually roll this out. And I think it's making its difference in small pharmacies it might be, but I think it does, every little bit helps.
Thank you. Can we just have your surnames, please?
Yeah, Flavel, F for Fred, Lavel. That's right. Thank you. Thanks, everybody.
No worries. Thanks,
I said it better myself. Well done.
Thank you. Thanks.
Well done. Thank you.
Thank you.